I'm here with Debra Betts, and we're here to pick up on some of the key issues that we discussed at Acupuncture Professional Impact last week. So, Deborah, one of the things that really struck me about your message to our practitioners was about how to better communicate with Western medical practitioners. And I was wondering if you could sort of pick up there around the value of that and some strategies to do so.
Hi, Kath. Hi, everyone. Well, my experience really has been that you can use research as a tool to grow your practice or to bring credibility to your practice from Western health practitioners. So for me, I sense a lot of acupuncturists are quite skeptical about research or reluctant to get involved. To me, it's just another language that you can use to your advantage and to generate referrals from Western health practitioners. So I guess I have an interest in that. And how do you get Western health practitioners to refer to you? And how do you talk to them so they have the confidence and the interest in referring to you? So that's my interest, really. I see acupuncture as this fantastic medicine that could really do useful things with working with Western medicine. It's not a fight, about which medicine is best. It's a matter of what's going to benefit the patients. And my experience has been that you can work with Western medicine practitioners, acknowledging that they think that they're the dominant Western system, but that there is a place for us. And I'm just interested in how we could create the biggest slice of that pie for ourselves.
And it's interesting because you talk about the idea of using their language. Research in itself comes along with its own language. So how would someone go about upskilling themselves and even taking an interest in sort of translating the acupuncture vernacular and then the research dialogue into something which then becomes a casual conversation with a health professional?
I think that's a really good point, and it is another language. And so it is really about reading the papers that interest you. There are some online seminars. I did one with Claudia about how to read a research paper. So it's sort of breaking it down into some basic components.
Could you highlight those for us? Because it'd be great to hear what those basic components are.
Okay, so well, it's kind of going through the fact of the terminology and just getting your head around, just like we talk about liver chi stagnation to mean a whole group of things that are meaningful to us, that in research there are words like bias, and there are words that have a meaning in research that are quite important. And if you can pick out the concepts that are important to Western medicine practitioners and you can use them to discuss your papers, then that gives you some credibility about being able to talk their language. I would like to say that I am not statistically minded. I would like to say that I come from a background, although it was a nursing background. I ran away from maths and statistics as fast as I could. I got interested in research when I became an acupuncturist and when I was treating a population, which was pregnant women, and people were asking me, is it safe? And this was coming from women, and it was coming from midwives, and it was coming from, doctors. And I had to go away and find something to write about in my information that I was putting in my pamphlets when I was giving my little talks. And the more I began reading these papers, the more I realized how I could use this to my advantage. And I was really self-taught. It's a lot of questions. It's like, well, why are they saying this? Why are they talking about statistical significance? What does that mean? How can you have a study where you've got one group of women and say 21 of them have an improvement in the acupuncture group, and 16 have an improvement in the group that got a placebo pill or just nothing? How can they then say that that's not statistically significant? Because for me in clinic, if 21 versus 16, I'd be thinking, oh, that's great, that proves acupuncture works. So you've got to kind of get your head around these concepts about statistical significance, about bias, about why randomized controlled trials are the golden, aspect of Western medicine, why they think they're so important, when to us in clinical practice, they don't reflect clinical practice. And there's really just reading those papers, asking those questions, slowly getting some concepts together where I felt, right, okay, I understand this now, okay, I understand that now. And the more that you read the papers and the more that you ask the questions, you get into, well, actually, this is quite interesting. And how could I use this? And what is this really saying about my practice? And just it got me involved so much that I ended up talking about the research when I was doing my presenting to other acupuncturists. And that really led me into doing my PhD, because there was something in clinical practice that I found fascinating, and I had the opportunity to explore it. So I learned a lot, and I think it is very challenging to immerse yourself in some of the research language, but it's certainly doable for all acupuncturists. It's just taking it step by step and breaking it down into what suits you.
Mm.
That's
One
a
of the things
long
I
answer to that question.
no, it's interesting though too, because one of the things I find with research papers is that the way that they're so structured that it's very difficult to feel like you're reading between the lines a lot. That I feel that that there's sort of they're so cryptic in many ways, and I'm curious to hear about you saying that you're self-taught in the language of research, of how long it took you to be able to see those, again, the key words, sample bias and population bias, or it's just sort of really interesting, I guess, to how to motivate somebody to get through that perceived barrier there.
I think that
Are there shortcuts?
I think you have to be interested. You have to be interested in the paper that you're reading for a rationale. Just learning about research to learn about research, I would find extremely tedious. So it's about reading on your subject and saying, okay, what's interesting about this? What does that really mean when they use that sentence? And these days with the internet, you can look things up. As I said, there's online forums, there's lots of books about how to read a research paper and just being able to take it further. So for me, my suggestion would be to go to the methodology section first, because that's the most interesting part. And when you read how they did the trial, you can decide, well, actually, this isn't very interesting because they were using laser, or they were looking at menstrual pain, but they were using spleen 6 for 10 minutes. That was their treatment. I'm not interested. That doesn't reflect, what I want to know. So you can look at the methodology section and you can start to kind of judge whether it's worthwhile delving into the other aspects of the paper. And then it's really just going through, and it's like a case history, like we ask the students to do. There's certain things I've got to say. Have they said them well? Does it make sense? Do they actually? Sometimes it's just to publish a paper, so they've got a lot of writing there, but actually you can tell when you start reading it that it's not what they set out to do. They've actually had to change what they've reported on, because obviously what was happening wasn't useful. So it just becomes more and more interesting the more you understand it. It becomes like a little puzzle as well. What are they actually saying in this research paper? But the other way that I was using it, apart from to find out what was happening or what might be interesting for me, was to use it as a tool for Western medicine practitioners. So even if the paper didn't say that acupuncture was wonderful, you can still present a paper to someone and say, look, I can send you some papers to show that acupuncture is safe. That if you do acupuncture to a group where you don't do to another group where it doesn't receive acupuncture, there are no more negative outcomes. Especially that's really looking in pregnancy, at miscarriage, at stillbirth, at problems arising during labour because people have used an intervention. So I find that's a very easy way to use acupuncture. And then when you do have an interesting outcome, but it's not a very high quality trial, and most acupuncture trials are not what Western medicine would consider high quality, because we haven't got the numbers and because of the way it's often set out as a trial.
Could you go into those two key points a little bit deeper as well? Why numbers is important, and perhaps the methodology as well?
Yeah, so one of the things that you can talk about, one of the big things is randomization, and that's to rule out the fact that if people are allowed to choose what they want to do, you may get people choosing to have acupuncture who have a whole lot of other factors involved in their lifestyle that gives you the result. So an easy example is you're doing a study on fertility, on helping women get pregnant, and you let women, just like we do in clinic, you let women choose, do they want to have acupuncture or don't they? And then you compare them to those that don't. If you let the woman choose, you may find that women who choose acupuncture also actually eat a lot of brown bread. And it's the nutrients in the brown bread that gives you the higher pregnancy rate, not the treatment you want to deliver. Whereas if you randomize people, you're going to get a mix of those who eat brown bread and white bread in your groups. And so why they like randomization is because it reduces that kind of bias. And that's the more people you have in your study, the more chance that you've reduced any of those other factors. And you're only looking at your intervention then, not all the other things that people might be doing.
And so what would be considered a strong number to give you some of that?
Well, they like hundreds. So that's why the large randomized controlled trials have a little bit more power and a little bit more weight. But randomization is still good because then you've at least tried to do some of those factors. And there's other biases, but that's one of them that comes up for us a lot. So the other thing is that when you look at the results, and they'll talk about it being statistically significant, which means it could be due to chance, but it's unlikely. And there's a whole rationale around how you start off a study and you say, this intervention, like this acupuncture treatment, will make no difference. That's what you start with. And then you have to prove that it does make a difference with your numbers, your statistics. And because you can't ever get 100% proof, you have different levels of proof. And so what we usually do is this 0.005, and it's a 1 in 25% chance, a 1 in 25 that you might get a wrong finding, but it's unlikely. So if you get that level of proof, if you get a statistical factor, a p-value, you can say, well, I got this finding and it's unlikely to be due to chance. So it still could be incorrect, but it's unlikely. And therefore, that's your p-factor. And then what you do is you wrap a confidence interval around it and you say, how confident am I that that result will actually work in a bigger population? So think about polling for the elections. If you take a group of 20 and you ask them, what they think, how confident are you that you can take that result on election night? If you have a group of 2,000, you suddenly become much more confident that your findings are meaningful. So those are the little sort of starting points. And so what you can do is if you have a paper that has something interesting in it that shows how useful acupuncture is, and it's not randomized, you just have to say, look, I realize this isn't a randomized controlled trial and there may be some bias in this population, but isn't it interesting that this paper found that these women, reported this and this, or there was, such a change in their pain score or their sleep. And then if it's a small study, which they often are in acupuncture, you say, right, I realize this is a really, narrow confidence, a wide confidence interval because it was a small study. However, isn't it interesting, etc., etc. And that by just putting the problems up front, that's often a really effective way to be able to talk to Western health practitioners. And then the second part of that is you have to give them good papers. So you have to recognise what is a good quality paper versus a paper that might look good, but actually anyone who knows anything about research will pull it to bits in a few minutes and say, oh, this is just, not good quality research. So to me, it's about just being able to identify a few good papers. And that's a bit of a problem now, actually, because you type into PubMed, you can easily find research. It's no longer a problem. You go into this website called PubMed, it's easily find on Google, type in acupuncture back pain or acupuncture nausea and pregnancy, and you'll just have a whole list of things to look through. So there's quite a lot of research out there, and you may only want to give someone 1 or 2 studies. You don't want to bombard them with 20 because they're not going to read them. So you just want to be able to pick out the best ones to make your point, and then you can say to them, look, in your conversation when you've had this, and they say, oh, it's a load of rubbish, isn't it? Or I don't understand why it works, or oh yeah, but I've heard that it's just this, placebo. You can say, well, look, can I send you a couple of studies about this in nausea and pregnancy? Or can I send you a Cochrane review? And they'll probably say yes, and then you just send them a little email saying, this is what I'm talking about, isn't it interesting? Happy to talk about this with you further. And that's all I've done, really.
But you're then saying that the practitioner should select what they considered a quality research paper from the plethora that exists out there. What would be some key things you'd look for if the result, so glowing results isn't necessarily indicative of a good paper. So what sort of things might be considered a credible research paper?
Yeah, so you're looking at where it's been published. You're looking at, a quick read through for the red flags about, the forms of bias that might be there, the reporting. So it just gets into, the more that you read and the more that you get these concepts and what they mean, the easier it becomes to read through something and to be able to pick, the key criteria that can make this credible. So what you're looking for a lot in research is critical analysis. So you're just critiquing and you're saying, no study's ever perfect. So you're just kind of trying to critique it to find out which is actually valuable to you. And there might be different, because you will be using it for some purpose, there might be different criteria that you're looking for in your papers. And it's just about understanding that research never proves anything. You're just answering a question. So you're answering a question to say, in these circumstances, how useful is this or how credible is this? You're not proving that this works because you're only answering that question for that population at that point in time. So to me, it's not a question of bombarding someone and saying, look, this proves that acupuncture treats back pain. There's levels of evidence that build up over time. And it's a case of just being able to use it to your advantage. And that's why I'm so keen on sort of these online education courses so that practitioners can get a handle of this in their own time and feel much more confident with it. Feel confident talking about it, feel confident to pick out some good quality papers, and feel confident that when they look at papers, they can use the results on their website correctly. So that in their advertising and in their pamphlets, when they talk about research, they're actually doing it from an authoritative background and not just trying to cherry pick something that looks good online, or the abstract looks good in the abstract, but actually won't stand up and it won't be credible.
It's interesting because when you talk about that, and again you've identified there's so much research out there, that you'd have to weed through and find the good stuff, and then sit and sort of for the early stages anyway, labor your way through the language. And when I speak to practitioners, a lot of practitioners just have the attitude of, I'm doing what I'm doing, it's working, I don't need to engage in that. Why do I need to go into that level of critiquing something which we know has worked for a long time and always will? What's the value in doing that? And and you're saying it's a great conversation starter with Western medical professionals. What are some other advantages then? Because it would strike me that a practitioner would have to be very motivated to overcome some of those hurdles in just being able to say, well,
maybe I'm making it sound too difficult. It's not. It's like, if you like reading, I suppose I like reading. So if you like reading and you've got a question, then it becomes a puzzle, and it's just solving puzzles for you. So to me, it's like being given something like a little key. So when you've got some information about the concepts and how you could use this, it's like having a little key to a little treasure trove that you can open up and rummage through. And I see it as very valuable information that you can get from Western medicine research, because you can then use that on your website. You can use it to, you can use it as part of your practice to get referrals. I see it as helping you get referrals, really. And yes, the bottom line is always going to be it's no good having these wonderful conversations and having these specialists or doctors or midwives happy to refer to you, and then the patient doesn't have a good treatment, doesn't get the results. They're just going to go back to their practitioners and say, I don't want to do that again. That wasn't helpful to me. I didn't, there was no benefit for me. So you've really got to deliver the results in the clinic. That's number one. This is just about helping people refer to you. So it's about stepping into their kind of mind frame so that they think, well, this is a little bit strange, this acupuncture stuff, but obviously this is going to be safe enough for me to refer my clients to. Or this is credible enough that I could understand why it might be useful. And so that they're not just thinking, oh, this is just so weird, I can't be bothered telling my patients about this, and yeah, so to me it's about being able to use it to your advantage and to start off with just some papers that you find interesting, whatever your passion is, what you enjoy treating. Have a look at what's out there, and then you can build skills so you can use that to your advantage. I think came up on the panel, but there's a lot of, as we get more and more normalized, as we become more accepted, there is going to be a backlash. We're already looking at that backlash, and the most effective way that I've seen to counter that is to use the Western medicine, language around research, because that's one way that we can counter that.
And the backlash being the skeptic brigade.
Yeah.
Sort of.
And the idea that we're in this kind of really witchcrafty, voodoo type medicine. And that one way to do that is to engage people in, well, can I send you some research papers about, functional MRI scanning and how this demonstrates this. So that's just an approach that I've found really useful. And for people who don't know me, I did start off in private practice, and it did turn into working with midwives, and it did turn into working with a fertility specialist who years ago had told us who'd been reluctant to have people use acupuncture and fertility treatment at the same time. So research opened a door so that we sat down at a table, and he was saying, right, well, how can we work together, because of, I'd like, my patients want this and the research shows it's safe. So, and then going from a very skeptical thing, and a very skeptical environment in the hospital with midwives using acupuncture and acupuncture being used in pregnancy, and people from the Skeptic Society being involved in the policy making of the hospital to say no acupuncture should be used in hospitals and pregnant women, to being invited, it did take years, to being invited in to run a hospital clinic, using acupuncture for pregnant women. So to me, it's chipping away, just kind of being there, just to keep on delivering the results, but first of all to sort of get the people to deliver the results, because otherwise we may just be shut on the outside. And so my concern is that unless we step up and undertake conversations and undertake to present ourselves in a way that's acceptable, Western medicine will cherry pick the bits they like, turn it into a framework that they can understand it, like neuralistic, fibers and delta fibers and all that sort of language, endorphins and things that they like, and they will turn it into their medicine, and it will just become part of their medicine. And we will still be seen as slightly outside in all our funny ideas, and they will claim it as their own. And sort of like that takeover idea, they'll just merge it into Western medicine and say, no, we understand it, we know what we're doing. And a little bit of that has happened with dry needling, I think. They've got their own explanations, they've got their own rationale, they think it's got nothing to do with Chinese medicine, and they've, I don't want that to happen really with the whole of Chinese medicine. I would like acupuncturists to be in the hospitals, running the clinics, and having conversations with Western health practitioners about what they do on that level.
Outside of research, what are other ways that practitioners can be doing that? It's obviously because so much of what you've said there is research, but that relationship building that's, and you referenced it taking years to build up those relationships, and thinking it's obviously there's a tenacity too in terms of just making sure that you continue to be, engaging with health services, and certainly making sure that they're aware of what you're doing all the time. What did you have systems in place in terms of letters going backwards and forwards, or how were you able to
Mainly just giving little talks and being prepared to stand up in front of obstetricians and things and give little 10-minute talks when I was asked to explain things, like when the latest breech research came out, and just being able to kind of stand up and say, well, look, this is what the research says, I know, and then answer their questions when they said, well, this is ridiculous. And here I am with my little moxa stick, so, this is what we do. And over time, it just becoming a little bit less weird for them. That's all I can say, really, is, and I think that nowadays there'll be a faster track because there are more people more interested and there's more credible evidence out there. So to me, it gave me a lot of confidence to engage in discussion with Western medicine practitioners. That's what research did for me. It gave me a tool, and I absolutely know that by doing that, they referred people to me. And then it's the clinical results that really count.
So that's how you get them in the door. So back to the idea of giving advice to somebody who's now taken they've taken what Debra Betts has said, and I love that key message being, make sure that you're pursuing information that you're passionate about first, because as you say, if it's a topic that you're interested in, you'll devour it, as opposed to feeling like you have to force your way into through the whole language of a research paper. So once you've chosen the topic you'd like to drill into further, where do you go then? You've mentioned PubMed and Cochrane database. Do you find there are particular journals that you gravitate towards, knowing that that's going to be a more credible source of information?
Yeah, so there are some of the complementary journals. I think there's a whole area around this. So, my advice really would be for people to get involved and to look at some of those online lectures about research as well, and to join. If you're interested in women's health, Claudia and I have got an online research club. So basically, we get at papers and sort of dissect them and discuss them. I know there are sort of online master's courses, that people can get involved in, and I think it's really just a case of stepping through a lot of those processes to get a good understanding as well. It's kind of weird. I don't think we have enough time. It's a whole, you could spend a whole hour talking about what is a quality paper, and a whole hour talking about statistical significance, and a whole hour talking about. So I'm trying to keep it really brief, and just to get people thinking about the fact that if it wasn't too difficult for me, I'm very confident that it's not too difficult for acupuncture practitioners out there, because it is not something that necessarily I would say that I'm gifted to be able to sit down and look at, at a paper and understand all the statistics in it. It just becomes more interesting when you want to find out the answers for yourself. And the other thing I should say before we wrap it up is there's all sorts of really interesting research coming out now, because there's a whole layer of these wonderful acupuncture researchers who are acupuncturists first in their life. They had a first life with their acupuncturists, and they're asking questions that we're really interested in. And again, they're using that research culture to build bridges. And they're producing research that's much more interesting to us than the research that was produced 20 years ago.
And what's a good example of interesting research for us?
So for example, my big thing is fertility and pregnancy, but so when you're looking at fertility research and you're giving women, there was a very nice study done by Carolyn Smith, who was my supervisor when I did my PhD, and one of the reasons I did my PhD was to work with people like, especially Caroline and others who are in this field, where you give people a survey. So you do a number crunching thing about their stress levels, and they're receiving acupuncture, and you're using a fairly flexible protocol. So this was a 5-phase and, included 5-phase treatment in there and an 8-principle approach. So you're not just using 1 or 2 points, you've got a good rationale for your acupuncture points. You do a bit of number crunching, so there was a survey about stress levels, and that came up as showing that yes, acupuncture did help on certain measures of the stress survey. But you interview women as well, and then you have special techniques where you analyse the interviews of women who had acupuncture. And out of that you get wonderful data about how women feel it helps them cope. That even if they didn't get pregnant, they enjoyed the treatments, and that it really felt like their Zen time, and it made them walk out of the treatment feeling they could now cope with all the medical treatment they were having. And those aspects, that qualitative research where you look at people's experiences, we usually find really interesting things with it buried in that research, and that is really useful to give those papers to say to fertility people, because not only have they got some of the number crunching in there, they have got the idea that they read that and they think, oh, I've got patients like that. I've got patients that, are ringing me up and are pestering the nurses and are bursting into tears on the phone. Maybe I should, think about this acupuncture. So you've got this idea that's bringing out the other things we do besides looking at just numbers. So you've got this, what they call qualitative research and mixed methods research, where you're looking at much more than just this narrow definition of research. And there are papers by people, if you put in Caroline Smith and you want to read any of her papers, Hugh McPherson, Charlotte Patterson, there's a whole lot of really interesting research going on by these very high quality researchers, professors really. Well, they are professors in the university system, and they are really helping us explore acupuncture in a much wider way than a lot of people think acupuncture, is being used just in randomized controlled trials. So I'm kind of talking a lot here.
That's wonderful. Not at all. No, I think it's so wonderful. But you mentioned also the people that are interested in learning further research, that there's MSc courses, and I know that now one of them is under your directorship. Could you tell us a little bit more about the New Zealand School of Acupuncture and the MSc that you're offering?
Yeah, I'd be happy to do some blatant
Yeah, absolutely. We're giving people an opportunity as to where to go next. So off to New Zealand for a holiday.
So something that I am, having moved through this now, having done my own, entry of fire into research and come out of it, is really about this idea of helping other people understand it and helping practitioners use it in their practice. So it's a master's, and it's an online master's, although you have 2 weeks. It's a 10-day course in New Zealand to start off with, and that's where you get to use all the technology, and we make sure that you're grounded in what you really need to know and can use everything and do data searching and understand the use of databases. And we do go through the basic statistical, information you'll need and the different types of research and methodologies, and it's fairly, lots of information in those days. And then you go away, and for the next 3 years you're online. So there's online forums that you contribute to, and discussions, webinars. So we have people, experienced people who are passionate about their own research. So someone who's passionate about survey design, or someone who's passionate about qualitative interviewing, talking to you about their research, and you get to watch these people from all over the world on webinars. And then you are contributing, so you're submitting your assignments online. And part of this is that you do a research module. You choose a module from women's health, musculoskeletal health, Chinese herbal medicine, or mental health, emotional health, and that's sort of more clinically based, where you'll have lectures from people in those areas, and then you have some sort of advanced research lectures as well. And I'm also doing the part of it that's all about contemporary, about CAM. Where do we fit in Western medicine? How do we talk about ourselves? What is alternative medicine? A whole sort of little box of ideas around how we present ourselves and where the future of integration is, and what do we mean by integration? So all of those sort of ideas. And then in your second year, you do a little project. We start you off doing a little project about, getting ethics and stepping through ideas that you might want to try out. In the third year, you're by yourself doing a research component, and we are supporting you and having supervision with you. And you write that up, and that will be papers or presentations, and obviously that's written up as a master's, so that's your dissertation. So over 3 years, you step through until you've actually produced a bit of research. And that's the other aspect, is as well as using research that's out there, it's about this whole layer of creating acupuncturists who are asking their own questions and moving the profession forward in ways that are valuable to acupuncturists. And we've got these fantastic people already there, but I want to see a layer of other people coming through. And this may never be that you'll work in a university as a associate professor, or move into writing grants for lots of research projects. But having done your master's, you will have a little bit of research that's contributed to the profession, and that may open doors for you as, again, just in terms of your own clinical practice and talking to others about different fields of research and presenting at conferences, etc. So that's what I'm sort of involved in, and we've just started last year, but people can find out all about it. It's all the modules and stuff are on the website online. I'm happy to answer questions people have. I also know there's an online masters in the UK. I think there's a whole lot of these programs that are going to open up for people to explore how to use research more effectively.
I think it's a wonderful note to end on, because I love that comment you made, that research is you giving back to the profession, rather than just going off to work, seeing patients, and then going home, and at the end of your career you close your clinic and you leave. That research is your legacy, and research is the building blocks of which practitioners to come will continue to embed ourselves within the healthcare system. So I think it's a wonderful what's the expression? It's a wonderful bequest. Oh, it's a wonderful. What is it when you hand somebody
A challenge, but
the challenge. It's like handing them a mantle. It's a responsibility which we all have to give something back to the profession.
Well, I guess for me it comes back to that idea that if people within our own profession don't step up and ask the questions and produce information that's relevant to us, and this is only one way of doing it, so I'm passionate about, we would like for as many people to use it as possible. If we don't do that, because acupuncture is such an effective form of medicine, others will do it for us, and they will do it in their way, their Western medical way. And I think that would be a shame if that's all that ever gets left behind. In 50 years' time, if it hasn't, if people haven't stepped up and looked at the information that's valuable to us, I think that would be a shame, because there are good models of people out there doing that and finding out really interesting things, and we can use that knowledge and we can build on it and we can move it forward in a platform. Just coming back to that idea that we can use it to our advantage. Yeah.
And as you say, now's a critical time to do that, isn't it? Exactly what you're saying. I can see if we don't do that, exactly what you're saying is there'll be a movement of which acupuncture gets swept up into Western medicine, and there'll be a little fringe, chi moving group that are so far out of the system that they're to become ineffective. Or what would break my heart is not become ineffective, but become a luxury. Become a luxury item for only people who can afford it, as opposed to the advantage of moving with the system means it's then making acupuncture more accessible to the people who really need it.
And I just like the idea, which has sort of happened in my, this is, I'm elderly, so this is like 20 plus years, But I like the idea that we're working in a hospital clinic, and I'm seeing these specialists in the corridor who years ago told people that acupuncture was a load of rubbish and that they should put paper between their toes to turn a breech baby, that would be just as effective. And they're not enthusiastic about acupuncture, but they know their patients are coming, and they're okay about them coming to the clinic, and it's sort of like a little bit of a Trojan horse idea that you've kind of got into the system and you've normalized acupuncture so much that they'll leave you alone and they're happy for you to be there, even though begrudgingly somewhat. And I like that idea. I like the fact that we can step in and make a claim to practice our medicine in our way, in our style, and be accepted. So I think it's possible, that's all.
Oh, I love the fact you're out there demonstrating it, but of course it's possible. You're doing it. So thank you for that. And thank you for showcasing the masters as well. Again, it's so wonderful to know that there's places where people can go. And I guess the challenge for anyone who's watching this now is to just spend a moment looking onto Google and finding a topic that you're interested in and reading one of the papers, and hopefully that will lead to further discoveries.
And the whole thing of being on a little treasure hunt, sort of something, I guess it's so obvious to me, but a good way to start, when you find a good paper with some people, some good authors, like I mentioned a few names, but there are lots of people in different fields doing really interesting research, you can follow them through to find out what other papers that they've had published, and you can also, at the bottom of each paper is a whole reference list, and you can follow those references that they've used back in time to look at interesting studies as well. So it is like opening up a little box and finding a little bit of this and a little bit of that and deciding what you want to, the leads that you want to follow through. So that's a good starting place, is just to find something you're interested in and to keep reading those kind of papers. Some of the papers are free online. Some of them, what I used to do is go and get them through Interloan in the library. So most libraries in the world have an interloan system where you pay $10. You have to wait a week or so, maybe 2 weeks to get your paper, but you can, from the abstract, select the ones you're really interested in, order them through your libraries, and start reading it if you don't have, for the ones that aren't free online. So there are ways to get access to research too. And obviously when you join research programs, you get given databases to search. Yeah. So
Oh, it's
probably
wonderful.
talked enough.
It's wonderful. Thank
But
you.
thank you, Catherine.
This is a wonderful introduction, and I would love to. We'll put this out there and see what response we get. And I'd love to just sort of throughout the course of, well, certainly with your master's course taking off, and come back every so often and just touch base and revisit some of those ideas.
Thank you, Kat. It's
Terrific,
great.
terrific. All the best.
Bye.
Bye-bye. Bye now.
Bye.
I hope you enjoyed this free webinar. Please take a moment to subscribe to our YouTube channel and please share on social media. The world will be a better place when more people know about the benefits of acupuncture.